Here we have a patient with a small, full-thickness tear of the supraspinatus tendon. I like to treat these patients with a single-row rotator cuff repair using a triple-loaded suture anchor. That's because it's efficient, economical, and it's very effective. The anchor is placed medial on the rotator cuff footprint. One limb of each suture is retrieved and then passed through the rotator cuff tendon using a scorpion suture passer. After all the sutures are passed, I then repair the tendon down to the footprint using an arthroscopic knot pusher and tying alternating half hitches. After the repair is complete, I use a power pick to create vents within the bone to allow the marrow elements to emanate and to facilitate better healing of the tendon. Here's what the tendon looks like after the completed repair.